Welcome to the information session of the Certificate 3 in Dental Assisting. We are presenting the current package, which is the HLT 35015 qualification. So the career outcomes for the qualification, it teaches you how to assist the dentist or the practitioner, dental hygienist, clinician, therapist or oral hygiene therapist during any oral health care procedure. So we teach you all aspects of dental assisting. The Certificate 3 enables graduates to work as a dental assistant chairside, including in the sterilisation area, but also at reception, so all administration duties as well. This is a minimum entry level to work in the dental environment. So to work as a dental assistant, you do really require to have the Certificate 3 in Dental Assisting. Once you've gained this qualification, you can go on and complete your Certificate 4 in radiography, which may lead to a career path in dental hygiene. So that is your career path. So minimum requirement is the Certificate 3, then you can go on and do your Certificate 4, and if you see fit, you might choose to go and do hygiene. So that's your career outcome. We have two types of delivery for the dental assisting course. So I'll go through the on-campus. So the on-campus cohort, it is run for over 12 months, and it's 2 days per week over 2 semesters. Okay, so first semester it's run 2 days per week. Second semester it is 1 day per week, and in the second semester you do have to gain work placement within the dental environment, but I'll go through that in a moment. We'll just go through the skills and knowledge that you do require to be a competent dental assistant. So the role does include maintaining high standards of infection control. So we teach you all aspects of infection control. You do chairside assisting with the operator. So we teach you all the different procedures to assist the dentist in a competent manner. We go through all the sterilising procedures, because once you use those instruments at chairside, you do need to know how to sterilise them competently. So we go through all aspects of sterilising, including using the steriliser, scrubbing the instruments, tracking the instruments so we know that they are sterilised competently. We also go over radiography. So we go over manual radiography. So we teach you how to manually develop radiographs, and we also teach you digital radiographs and what the requirements are there to keep you safe and to keep your patients safe. We have 2 elective units, which are the oral hygiene units. So we teach you how to give oral hygiene instruction to your patients. And as I said before, we also teach you the administration skills required to be out at reception. So the patient comes out, we teach you how to communicate correctly with them, privacy aspects, also different item numbers and codes, and all the information that you need to be able to process a payment, maybe out at reception, answer the phone, etc. We also teach you how to communicate correctly with patients, and you need to do this in a professional manner, because working in a dental practice, usually they are owned by the owner, so they expect you to have a certain level of professionalism. Okay, to achieve this qualification, you need to have 50 hours simulation here on campus. So we do that with you, 50 hours. We have a sim room. And then, as I mentioned before, you do have to have 250 hours out in the workforce. In a dental practice, we do help you try and gain this placement. We give you all the paperwork that's required and all the support that that is needed, but we don't guarantee that you will get this. But having said that, over the last couple of cohorts, the last couple of years, I think 95 to probably nearly 100% of students have gained placement in a dental practice. The units of competence that we will be covering over the duration of the course are listed here on the PowerPoint, so I'll quickly go over this. So it's communicate and work in health or community services, work with diverse people, so you know how to communicate with a diverse range of people. Participate in work health and safety, so we keep you and the client safe. Infection control, processing reusable instruments, that's what I mentioned before in the sterilising room, how to process the instruments in a timely manner and up to a certain standard. Prepare for and assist with oral health care procedures, so that covers all aspects of instruments, materials, assisting the dental operator, using the suction and all aspects. So that is quite a large unit that also has the 250 hours attached to it. Doing that 250 hours in the dental practice does not deem you competent. That's when we come out and we actually we assess you in that workplace. So we assess you with 3 patients in that workplace to make sure that you're operating correctly. We'll go over that if you go ahead with the course a bit more. We also cover dental radiography, which I mentioned before, administration, first aid, so is another component. So you must have your current first aid certificate, which we deliver here on campus. And then the 2 oral health units, which is recognise and respond to oral health issues, and also provide or assist with oral hygiene. They are our 2 elective units. So they're really quite interesting and fun because you can learn how to communicate and give oral health instruction to a diverse range of patients. So there is 11 units of competence in the dental assisting course, and that is those. So those 11 units of competence make up your Certificate 3 in dental assisting qualification. Assessment and delivery, as I said before, we deliver on campus, face-to-face and online. We have simulation and we have workplace assessments. So as I mentioned before, the workplace assessments, we come out to your workplace to assess you, but we do simulation in our simulation room here, which would be face-to-face. We also deliver online, so it's blended. You are expected to attend classes if they are scheduled, and they're usually 9 to 4 p.m. You will have assessment tasks to complete. You will also have online tests to complete, presentations. You may be required to do some role plays on campus, and definitely practical simulation demonstrations in our sim room, and that's where we log 50 hours that you do that. When we do come out to your workplace, we observe your skills and we ask you questions to deem you competent. There is an opportunity to resubmit work to address certain issues, and we do have support here if you need it. But just down the bottom there, it is compulsory to have the work placement requirement of 250 hours, and that is yours to get. We don't get that for you, but as I said, we help you get placement as much as we can. At this stage, it is going to be delivered on a Monday and a Friday, 9 to 4, and classes are due to commence on Monday, the 13th of July. So that would mean your completion date would be the 25th of June 2021 at this stage. We do have a compulsory orientation session that you must attend on Monday, the 6th of July. If you do have placement already, or if you are employed as a dental assistant, this is the second model that you are working as a dental assistant at the moment. You don't have to attend classes. You can do a different delivery that's online and face-to-face. We come out to you in industry. So that's another model. So if you do have a job and you don't want to come to our on-campus cohort, we can deliver it to you online, and as I said, we come out to your industry 3 or 4 times over the duration. So, but you must be employed to have that option, and you may or may not be signed up with an apprenticeship centre, so that would depend on your employer. So that means you would be enrolled as an off-campus student, but we can answer any questions if you have got a job already, about that a little bit later. General course considerations, we do require you to have a working with children's check and a police check, and you must have current immunisations of those listed there, MMR, hepatitis B. So all applicants must be eligible for and have prior to undertaking work placement and for the future employment. So you must have those immunisations prior to you doing your work placement. You can get this by going to your local GP, and then we ask you to upload it on Student Web. To work in a dental practice, you must enjoy working in a high-paced environment. You must be a team player because dental assistants all help each other. It is a team environment. So if you don't like working in a team, it would be very difficult to be a dental assistant because you all help each other. You must be patient, flexible, and willing to take responsibility. And for your study, you must have a good digital literacy, ability to time manage and meet deadlines. You must have good communication skills, and you must be committed to your study because you have timelines for your study. So you'll be possibly working and studying at the same time. The course fees, you need to refer to the fees listed on the website. If you are eligible, there is free tuition at the moment, but you will, if you qualify for that, but there is a service and amenities fee, there is teaching materials fee, and there's a diagnostic fee. So you need to speak to admissions about the fees or go on the website if it's on there. Direct entry process. So you're attending this information session. At the end of this session, there will be a presentation on how to enrol. But basically, you can submit an application online. You complete the core skills diagnostic test. They do a little interview with you, and then they check to make sure that you're eligible for the free TAFE. If you're not, you'll be full fee. So, but they will put a presentation on when we have finished this PowerPoint slide.